And now I'd like to turn to you, Yoshi, and we'll have a geopolitical, geoeconomic perspective in this panel. Yoshi.
Thank you for your kind introduction. It is a huge privilege to participate in the World Policy Conference with renowned panelists. Prevention is always difficult, challenging topics for policymakers in terms of mobilizing political commitment and also resources. And this is not the first time the world has emphasized pandemic prevention. And my concern is that we may be repeating the cycle of panic and neglect. So in 2014, after the Ebola pandemic, the US, along with other 40 countries, and the WHO launched the Global Health Security Agenda. In hindsight, 10 years ago, there was an kind of an assumption that pandemics would severely affect Africa, the Middle East, or Asia, not developed countries. And we now know that the assumption was completely wrong. The COVID-19 pandemic proved catastrophic, causing national crisis in lives and livelihoods across all countries, and millions of lives were lost in developed countries too. So during COVID crisis, what started as a global health security agenda transformed into a national health security agenda. And so there was a panic triggered by the COVID, and it prompted global health experts to discuss prevention, preparedness, and also the international health regulation and the pandemic treaty. And we had some results. In June 2024, the World Health Assembly decided to amend the international health regulation and to define and decided to strengthen national core capacities, which are needed to protect public health. But despite these efforts, global leaders are gradually losing interest in pandemic. So the neglect phase has already begun. So now experts have to remind policymakers that pandemic prevention is not only for a global necessity, but also for a matter of national interest. And to do so, I believe operationalizing pandemic prevention agenda is critical. So I would like to highlight two key areas. One is surveillance, and two is universal health coverage, UHC. And I'd like to share some experiences from Japan, because you may know that in Japan, 30% of its citizens are over 65 years old. So it's very aging society, but despite the world's highest senior populations ratio, during COVID, Japan's COVID deaths per million were among the lowest in the G7 countries and also second lowest in the OECD. And I think surveillance and the UHC played a critical role in such outcome. So first on surveillance, effective surveillance mechanism to detect pathogens is essential for future pandemic preparedness. For example, in Japan, Japan detected its first COVID-19 case on January 15th, 2020. So January 15th, it's very early. Outside China, Japan was the second case, following Thailand. And why Japan could detect the first case so early? One reason was that the Olympic. So because the Tokyo Olympic game was scheduled for 2020, since 2019, Japan had invoked a surveillance mechanism for suspected infectious diseases. So if doctors find any suspicious cases, they were advised to report to local health centers. And despite limited PCR testing capacity, potential cases were referred promptly because of CT scanners. So in Japan, we also lacked PCR testing capability, but luckily, there was some preparation, and also because of the CT scanners, if doctors find some symptoms, then there was a mechanism to refer to health centers. So I think it worked in Japan. And second is the universal health coverage. The universal health coverage, UHC, ensures that all people can access the health services they need at an affordable cost throughout their lives. So UHC includes essential health services, health promotion, medical treatment, and rehabilitation. So in short, easy access to medical services can prevent the spread of outbreaks and also save lives. And I have reviewed joint statements from major summits this year. So for example, the Puglia G7 leaders communique from Italy, and G20 Rio de Janeiro leaders declaration from Brazil, and the BRICS Kazan declaration from Russia, and the Pact for the Future agreed in the Summit of the Future in New York during this year's UN General Assembly High-Level Week. All of these documents underscore the importance of promoting UHC. So there is some political commitments to promote universal health coverage, and UHC is a foundation for national capacity to save lives. However, maintaining UHC requires significant investment. And because easy to access hospitals and affordable care, it requires a lot for the government for investment. So for example, Japan's case, Japan's social security expense account for almost 24% of its GDP. And given the security situation surrounded by Russia, North Korea, and China, Japanese government is aiming to expand its defense expenditure. But the target is around 2% of GDP. So in Japan, Japan spends around 12 times of defense spending to its social security. So it costs a lot, and this investment requires a lot of efforts, but it worked during COVID. So what Japan is now doing is to share those experiences from UHC, and in collaboration with the World Bank and WHO, Japan is now establishing a UHC knowledge hub in Tokyo. So I'm hoping that those Japanese experiences can help the world to have better knowledge and also have to learn some lessons and also even failures from some countries. So as the UN Security General Guterres said, no one is safe until everyone is safe. So in order to protect our citizens and promote prosperity, global health is critical. And we have to remind policymakers again and again and make the proposal to be much more relevant to policymakers. And to do so, sharing best practices and lessons learned between nations to strengthen national prevention capacity is critical to prepare for future pandemic. So I believe the operationalization of prevention agenda, especially through the robust surveillance mechanism and also promoting UHC, are critical. Thank you.
Thank you.